India is now the global coronavirus hotspot, setting records for the world's highest number of daily cases. So hospitals are filling up as medical staff and the public alike make desperate appeals for oxygen supplies. The country had 17.3 million confirmed cases as of 8 a.m. Monday morning, and more than 195,000 people have died, according to government data. With us today is Dr. Gabe Kellen. He is the Director of Emergency Medicine for Johns Hopkins Medicine, and he now joins me from Baltimore. Dr. Kellen, thanks so much for being here. This has been a really difficult, tragic time for India. They're calling it a tsunami. We want to get your take. Did we even see this coming? I mean, was there any sort of expectation that it was going to get as bad as it has?
Yeah, I think this was virtually inevitable, and any other country like this that is teeming with people. I mean, India, I think, is now the most populous country in the world, close to 1.4 billion people. This is only their second wave, whereas for many of us, we're in our fourth wave. So they're just climbing their, getting to the peak of their Mount Everest. Many people live very, very close together, and there are variants of this virus that are stickier than the original. This was almost inevitable.
And Dr. Kellen, I mean, over the weekend, we heard from Dr. Fauci and also President Biden saying that there were going to be supplies that were potentially sent to India to help them. I mean, how do we turn the situation around? How is this going to change in the near term?
Well, this is going to take some real massive effort if the need for supplies is as big as the reports are. I mean, India is a very, very big subcontinent country. There's a tremendous number of supplies that they in fact need, and it's going to require a very concerted effort among first world and other countries to get a reasonable supply, particularly of oxygen and tubing and vaccine to this country. Let me say parenthetically, one thing that is not helpful, many people here in the US have relatives and doctor friends over in different parts of India. And we're getting endless appeals from hospitals and others to send a little bit of oxygen over, somehow put it on a plane, or someone's going to travel over and take an oxygen tank. That is not the right way to send supplies to a country in need. It really has to be a very major, highly coordinated and concerted effort to make sure the supplies get to where it's needed.
What happens if it is not that way, though? I mean, I'm actually surprised to hear that people are getting those requests. Why is that not the way to do it?
Well, for a number of reasons. In these major crises, these individual contacts that people have in the country, you don't have real situational awareness. It's a telephone call, pleading, I work in X hospital, here's what we need. You send it over, it might get stopped at the border, it might get sidetracked, there's a huge black market, it might get pilfered. There's no way to know that what you're sending over, however puny the amount is actually going to get to wherever you think your contact is. And sometimes it's the wrong type of equipment, it doesn't work over there. And so you really do need to know what you're doing. And if you want to send adequate supplies, you need good situational awareness, and you need a very concerted effort.
And Dr. Kellen, I want to shift here to the U.S. We're seeing the rate of new vaccinations sort of start to decline for the first time on Saturday. It went down. How concerning is that to you?
Well, I think it should be concerning to all of us. We're right now at the intersection where vaccine is increasingly available, but there's a set of class of people who are still in wait and see mode. And there's a set of people who are just not going to get it, right? And we know that there's politics to this. They're in the more rural or sparsely populated areas. They don't consider COVID quite as serious. And when you think about it, people who get very, very sick in sparsely populated areas, those people get shipped into the city to ICUs and other hospitals. So people in more sparsely populated places don't have as much direct experience with very, very sick people. But that's not the only reason. There are philosophical reasons, there are religious and political reasons, as we know, which is totally strange, but in this country, maybe not so. Hopefully over time, we'll break down some of these barriers. We should keep in mind that some of the hesitancy is not really hesitancy. It's proven to be access. And if you make the vaccine more available for certain communities, people who are disadvantaged, people who don't use computers as well as others to find a vaccination site, people who don't get around, they're in senior housing. So they're people who want it, but we have to bring it to them. And those programs have been very, very effective when we do these mobile clinics. But it's a very heavy lift, and it requires a lot of people to bring vaccine out into the community rather than having people come to you at a major place.